treatment and therapies. At the end of the session, you should be able to gain knowledge and insights on the major forms of psychotherapy, elucidate the ethical standards and the use of psychotherapy, evaluate the strengths and limitations of each given therapy, and appreciate the significance of psychotherapy in the prevention and treatment of psychological disorders. Psychotherapy is a form of therapy in which a trained professional uses methods based on psychological theories to help a person with psychological problems. The term psychological methods can refer to almost any kind of human interaction, such as talking, that is based on a psychological theory of the problem. But it does not include medical treatment methods, such as medication. Psychotherapy is considered to be ethical only under the following circumstances. First, the goals of treatment must be carefully considered with the client. These goals should be in the best interest of the client and society, and they must be fully understood by the client. Second, the choices for alternative treatment methods should be carefully considered. Third, the therapist must only treat problems that she or he is qualified to treat. Fourth, the effectiveness of treatment must be evaluated in some way. The best way of doing this is to use meaningful measures of the problem and progress in treating it. Fifth, the rules and laws regarding the confidentiality of all information obtained about the client during treatment must be fully explained to the client. Sixth, the therapist must not use the power of the intense relationship with the client to exploit the client in sexual or other ways. 7. The therapist must treat human beings with dignity and must understand and respect differences based on gender, ethnicity, sexual orientation, and other sociocultural factors. What are the types of psychotherapy? First, we have the psychoanalysis. Psychoanalysis is the approach to psychotherapy founded by Sigmund Freud. It is based on Freud's belief that the root of all psychological problems is unconscious conflicts among the id, ego, and superego. Techniques of psychoanalytic psychotherapy. First, free association, a tool used by Freud in which the patient is encouraged to talk about whatever comes to mind, allowing contents of the unconscious mind to slip past the censorship of the ego. Dream interpretation, a method developed by Freud in which the symbols of the manifest content of dreams that are recalled by the patient are interpreted to reveal their latent content. Interpretation of resistance, any form of patient opposition to the process of psychoanalysis. Interpretation of transference, the phenomenon in psychoanalysis in which the patient comes to feel and act toward the therapist in ways that resemble how he or she feels and acts toward other significant adults. Catharsis, the release of emotional energy related to unconscious conflicts. Interpersonal, psychotherapy for depression. Interpersonal psychotherapy is a form of psychological therapy based on the theories of neo-Freudian Harry Stock Sullivan that focuses on the accurate identification and communication of feelings and improvement of current social relationships. Interpersonal therapy was developed to treat depression. Humanistic psychotherapy. The humanistic school of thought, like the psychoanalytic school, believes that the primary goal of therapy is to bring feelings of which the individual is unaware into unconscious awareness. Client-centered psychotherapy, Carl Rogers' approach to humanistic psychotherapy, in which the therapists provide an atmosphere that encourages clients to discover feelings of which they were unaware. Cognitive behavior therapy. In this therapy, the therapist helps the client unlearn of usual ways of behaving by learning more adaptive ways of behaving and changing maladaptive cognitions. Cognitive restructuring, a CBT method in which faulty cognitions, maladaptive beliefs, expectations, and ways of thinking are changed by pointing out their irrationality. Group and family therapy. Psychotherapy conducted in groups, typically of 4 to 8 clients at a time. Family therapy is an approach to psychotherapy that emphasizes an understanding of the roles of each of the members of the family system, usually conducted with all members of the family present.